When responding to an emergency, it's important to recognize that a person with dementia reacts in the environment differently than someone who does not have dementia. We knew that we were responding to a call for a person that has dementia because the 911 operator told us. This helps us to be informed and enhance our personal interactions. On this call, we use the REACH approach. We start with R, which is risk perception. We know that a person with dementia has fallen in the bathroom. We know that he is seeing things not seen by his wife, and he's injured. This could potentially be a high-risk situation. Once we arrived on the scene, we determined there was no intruder, and William had an injury that required transport to the hospital. We needed to establish and maintain his trust. According to the E in REACH, the best way to do this is with effective communication. I immediately bent down to his eye level and introduced myself while explaining why I was there. I spoke in a slow and calm and direct way without judgment. Knowing there was no intruder in the home, I noticed a reflective surface, in this case, a mirror, and I directed Andrew using nonverbal gestures. This intruder, most likely William's own reflection that he did not recognize. I nodded my head in the direction I wanted Andrew to move in order to block the reflective image. I then reintroduced myself. This was a quick way to distract William from what he was seeing and allowed him to focus on a team member. I made sure not to correct him and tell him there was no intruder. To ensure a calm environment, in keeping with the REACH acronym, we limited our talking and used nonverbal gestures when possible. By limiting our verbal communication, we kept distractions to a minimum. Noise may be amplified and distorted to a person diagnosed with dementia, and we know having multiple people in a small room may be distracting. While we focused on William, Brady spoke with the wife. The EMS team communicated with each other using gestures, and I was a team member speaking to William throughout the visit. This allowed William to focus on one person throughout the treatment, helping me to gain his trust and keep him relaxed. Maintaining healthy partnerships is always our goal. Increasing our knowledge of how to best communicate and interact with someone that has dementia is the first step. Figuring out the reason behind the report of an intruder is another way to help William and his wife. Brady was asking for change in medications or health changes to rule out a side effect or illness. Brady could discuss with Helen the possibility that William did not recognize his reflection. Many times, a person with dementia will not recognize their older self, which results in subsequent fear or agitation. In this case, William's fall.